Hello, this is Devon again. This will be my video on trach suction and care. This is my little bear. He has a little trach, well, not necessarily, but this is the oxygen on top of the trach. The trach is underneath. I have my stethoscope and my pretend tools for my saline and for cleaning and stuff. All right, so I'm going to walk in the room or knock knock, introduce myself. Hi, I'm Devon. I'll be your student nurse today. I'm coming to do. So I have orders to perform trach care. So I'm gonna do some suctioning and cleaning of your trach. Is that okay with you? Patient agrees. Ask the patient if they have any questions. Identify my patient, name and date of birth, and verify the wristband. Okay, for trach care, we are going to auscultate lung sounds prior to, so I'm going to use a stethoscope, and I'm going to auscultate lung sounds in the right and left lobes, right and left. Everything sounds fine. So then we're going to raise the bed, raise the bed to a comfortable position, approximately hip level. Adjust the patient to the high Fowler's position. And then I will get all my stuff. This is a sterile procedure, so we would have to create a sterile field. Prior to, I got all my stuff. I'm going to do some hand hygiene. I'm going to don gloves. I'm going to loosen the trach strap on the side, just so that the oxygen could move when I need it to move it. Before I start, I'm also going to connect the the tubing to the suction device on the wall. I'm going to make sure that the suction device is set to 100 to 120 grams mercury, or millimeters mercury. What else do I do? And turn on the oxygen, and maybe get an ambu bag if I need one, depending on the patient's need for oxygen, on the patient's need. So is we have to hyperoxygenate the patient prior to this, because we're going to be moving their oxygen left and right. Also, we have to put a pulse ox on the patient's finger to help keep track of, the oxygen level. Okay, so now I got all my stuff on the table. I'm not yet sterile. I still have on my gloves. I want to open my sterile packaging away from me. Set up everything that I need. I'm going to put my we have a drape, but that drape goes over the patient. I don't know, I've watched too many videos. But I do know that we should have a sterile drape on the table for our supplies to go on. And then maybe there's something in addition to that goes over the patient, which is also sterile. And I guess that depends on what kind of container you end up, or what's in your package when you open it. So first thing I'm going to do after opening the packaging, I'm going to loosen my saline cap, or actually take it off if there's not one already provided in there, and I have to use an additional saline, then I would just take the cap off of that prior to. So I'm setting up, well, no, first I have to put on my sterile gloves. So I'm putting on my sterile gloves and taking it off and putting my hand in there. Okay. I'm going to set up all my stuff. I have some Q-tips for cleaning of around the stoma. I have some gauze that I can moisten along with the Q-tips to clean the trach plate. I may have saline in there and a few buckets to fill with saline for cleaning. I'm going to have a brush to clean the inside and the outside of the trach. And I'm also going to have pipe cleaners to dry it, the inside of the inner cannula, I should say, because that's what we're going to be taking out. So I am sterile still. I have everything set up on my table. All right, so at this point, oh, and I also have a replacement, what's it called? Dressing that's gonna go underneath the trach after we're done. So then we're going to remove our trach dressing. Well, I guess I don't have to do that first. Let's do that last. So since I'm sterile, we're gonna go ahead and we've already hyperoxygenated the patient, removed the trach cap, the oxygen cap over, hyperoxygenated, and now we're taking out the inner cannula for cleaning. Let the patient know, okay, I'm taking out the inner, your cannula, and I'm gonna clean it, okay? So I'm taking it out. Oh, wait, we gotta suction first. So we move the oxygen, hyperoxygenated. Okay, so we're going to get our suction tube. This side's connected into the wall. The actual suction is coiled around our hand. So this is kind of connected into the wall. So to perform suction, we would test this into the saline, the clean saline, and we would normally have a little button right here that we can press to test the suction so it's working properly. All right, so then we will take this and we would insert it down in a curvature motion without suctioning. We want to suction when we come back up, and when we come back up, we're kind of gonna move it, and then we're gonna suction again in the saline solution, 1 bucket of the saline solution, and then we were gonna go back in a curvature, downward curvature, and we're gonna come up, and we're gonna kind of circle as we come out to stop from making a mess of the patient's chest and maybe splashing on ourselves. Okay, and we're gonna, okay, so after this step is over, we're gonna wrap the tubing up. We're gonna disconnect it from the wall. I'm gonna wrap it in our gloves. Toss it. Done. Okay, we'll put the patient's oxygen back, and then we're gonna do hand hygiene, don sterile gloves again, so that we can move forward to cleaning the inner cannula. So we're donning sterile gloves, or sterile again. We remove the inner cannula, clean it, drop it in the saline bucket, a clean saline bucket of solution. Take our brush and clean the inside, the outside. Now for this part, I've seen some people clean with saline, or they'll just put in a saline bucket, and some people do hydrogen peroxide. So I'm gonna guess hydrogen peroxide is probably gonna be the better option. So let's assume we're cleaning with that. Cleaning the outside, around, and then we're gonna rinse with saline. I've seen people pour saline through, or just put it in a bucket with saline and kind of turn it around, turn it over, just to rinse the inside of the cannula. So after that, we're gonna take our pipe cleaners and we're gonna put them through one direction and pull them out, and then we're gonna do that until it's dry, or until we're out of pipe cleaners. Hopefully by then it is dry, because I think the set comes with like 3. All right, so once it is dry, we would replace it, put the cannula back in the patient's trach, and follow the locking instructions, usually located on the device itself. Okay, so it's locked securely in place. And now we're gonna clean around the stoma with the Q-tips, and we would just go around the stoma, and then toss each Q-tip. It comes with 3, so we would do the upper and the lower, and then either take the third one and clean the actual plate, the trach plate, or I've also seen people clean the trach plate with the moistened gauze, so we can do it that way also. So after that's all clean, all that is tossed aside, we are going to replace the trach straps, but we do not take the old ones off until the new ones are completely secure. Replace the patient's oxygen, continually assess them and ask them how they're doing, and how everything, how it feels, if they have any questions, things like that. Also assess pain, make sure that they're not feeling any pain, and that they know to express if they're feeling any pain or discomfort. So now we are going to change the dressing, the trach dressing underneath, and once we take that out, we're going to be assessing for color, odor, consistency, if there's anything that has spilled, or if there's any drainage on there. We need to check and make sure see what it is, so that we can document it properly. Okay, once that's assessed, we toss that, and then we put a new one on. And at this point, we are no longer sterile, so we have some little tweezers that we can help pull that through with, being careful not to knock the trach out of place, so we have to be pretty gentle getting that in there. And once that's in place, we are done with our trach care. So then we put our patient back down to the lowest position, Make sure the bed is locked. Assess the patient again. Let them know that we are done. Ask them if they need anything. We're going to take off our gloves. And we're going to do some hand hygiene. Rubbing until it's all done. It's all dry. And discard of all of our stuff, and that'll be it. But that should already be done. So make sure the patient has their call light, and let them know to call us if they need anything. And that's it.